Join me as I walk you through how to check yourself for a diastasis. Now, a diastasis recti is a separation of the abdominal wall. So if you think of yourself as having two six-pack ab muscles, after you grow a baby in your belly, that tends to stretch out. And the distance between the two six-pack ab muscles, the rectus abdominis muscles, gets wider. Super common and actually super normal. But we need that to recoil and come back together postpartum. We also don't want to lose too much tension in that separation. So if that separation has occurred for you and you feel like you can just like stick your fingers deep inside your belly and there's just not a lot of tension underneath there, that's what we want to build back in order to help you heal the separation and decrease your separation of the six-pack ab muscles. So we want to heal your diastasis, and honestly, you don't need a fancy online program to do this. You just simply have to learn, first off, number one, do I have a diastasis? At what part of my abdomen is the diastasis? I want you to take a look at this photo right here, and I want you to look at all the different places that one can have a diastasis. Now, we're going to learn how to check ourselves for a diastasis. And so now that you've seen this picture, I want you to be able to say, okay, I'm going to check myself in all these different places, and you're going to understand why we're checking these different places, because people can have separation and thinning at different places along their abdominal wall. Okay, so we're going to get into this position here. We're going to look at the belly, and we're going to go all the way down. So we want the full belly present. This belly here has had 3 kids. And so the very first thing we're gonna do is we're gonna lift our head up off the floor, off the table, off your bed. Okay, and now we're looking at our belly. Is anything happening here when you come up? Now, if you have a diastasis, you might notice that you have like coning. I'm pushing out here to show you, but if I can also kind of like make myself have a little cone right there. And so you're looking for like, am I tenting or do I have a coning position when I crunch up? Do I see any of that? Okay, if the answer is no, then good, that's a good starting place. But still we want to do a little bit more in-depth testing to make sure we don't have a diastasis. So we're going to take our fingers, we're going to put them right at the belly button. We're going to again lift our head up. Okay, do I feel any separation right at my belly button between my 2 fingers? I feel about a finger and a half. So a finger and a half, that is clinically normal and so not considered a diastasis, all right? And so we checked right there. Now we're gonna work our hands up, 2 fingers here, and now I'm gonna crunch up again. Do I have any separation? Can I feel any separation here? Can I push in? Okay, no, I can't, but you might feel like, oh yeah, that feels like there's a little hole in my stomach there. Now that would be the feeling of having a diastasis, and again, we're above the belly button. Okay, then we're gonna work our way up between the ribs, crunch up. Do I feel a separation? No, okay, good. Come back down. Okay, then we're gonna go all the way to the sternum. Everybody's torso is a different length. So if you have a longer torso than me, you are gonna be checking more spots above your navel than I am checking here. And so I'm putting my fingers right here, coming up. Okay, don't feel any separation. Now we're gonna go back to the belly button and we're gonna go down below the belly button. All right, and then I'm gonna crunch up. Do I feel any separation below the belly button? Okay, come back down. And then you're gonna work your way all the way to the pubic bone. So you might have to straighten your legs to do this, but you're gonna go down to the pubic bone. And again, you might have a longer torso, so it might take you more positions to feel the separation. And then you're gonna lift up here. Okay, do I feel any separation? No, great. This is a comprehensive test for diastasis recti. After you've established if you have a diastasis recti or not, I want you to go back to the picture that we just showed. So we're gonna show this picture again, and now I want you to see, okay, like that's where my diastasis is. That's where I need to make sure that when I'm doing a crunch or when I'm getting off a chair or a couch, I'm not creating more separation wherever my diastasis is. It means that it's the area that you need to be more attuned to. So whether that's you getting out of bed, whether that's you picking up your kid, whether that's you doing a plank, or any type of exercise, if you know that your separation is either right at your belly button or below your belly button, then you have to make sure that you try to hold that area tight and keep that area tight when you're working out. If you feel like that's actually causing more separation, then you should see a pelvic expert physical therapist, someone who can help you restore the quality of your abdominal wall and improve the coordination of these muscles. Because oftentimes it's simply the coordination of these muscles that's going to help you heal the diastasis recti. I'm Dr. Allison Felt. I wish you the best on your postpartum healing journey and all the healing to your abdominal wall. It is never too late. We help women that are 10, 15, 20 years after having a diastasis recti, and they're able to heal it naturally without surgery and without any crazy exercise regimen. So just knowing how to position your body and yourself in your life is super important in helping taking the constant pressure and toll off of the linea alba, which then allows the diastasis to heal. Please drop me any questions you have in the chat. I'm happy to answer them. Check out more of our videos all about diastasis recti and how to start healing your diastasis today.